Hello friends. Welcome to YouTube channel Health Q. So I'm live back again. Today we are going to discuss about Bell's palsy again, and to be very specific, what I would be talking about would be the do's and don'ts in the early phase of Bell's palsy, because that's one of the most crucial thing that I feel every patient who suffer from Bell's palsy should be educated about, and that's why I thought of coming live. So this week I'm doing three live sessions. So today is one session. I have put the details in the comment section as well as in the community tab. So if you have subscribed to my channel, you'll get an information about every live that I do. So I would be talking about Bell's palsy in detail on this video. Then Wednesday I would be coming live again 5 p.m. and that day we would speak more about cerebral palsy, and then on Friday I would talk more about back pain. So these are the three core topics which I talk about in my channel. So that's why I thought I'll talk about it. So today is about Bell's palsy. I hope you guys can hear me well. If yes, please put a thumbs up in the comment section so I'll get an idea that yes, you guys can hear me. And feel free to ask your questions if you are suffering from Bell's palsy. Okay, so without further ado, let's start. And so today's topic is do's and don'ts of Bell's palsy, one of the most important thing I believe every patient who suffers from Bell's palsy should know about. So if you are someone who is suffering from Bell's palsy, like you have recently developed Bell's palsy, then this video is very important for you guys. So Bell's palsy, right? So I have been working in this space past 3 years now, exclusively on Bell's palsy. I do come with neuro rehabilitation background, so definitely I study in detail about all this kind of paralysis related condition in my graduation. But past 3 years, I have been working very closely with it. I have seen more than 100 patients suffering from Bell's palsy at different stages. I've helped them, and that's why I believe I pretty much know in detail about this problem. So that's why whatever I say makes sense to people, and I would like to help you out through this video as well. So I'll come over to the questions, guys, but let me first finish what I have to say today in today's video. So what I believe, Bell's palsy never happens without any reason. Any patient who gets Bell's palsy have three common things in their history. Okay, so the first and the most foremost common thing is stress. People who develop Bell's palsy and is not able to identify the cause behind it, then one of the biggest cause for Bell's palsy is lack of sleep and stress that has been involved in the days previous, like before they got Bell's palsy episode. Either it was work pressure, either it was some personal issues, either it could be some event, some exams, something which had led to sleepless nights, or else work related stress. That's the reason you could get Bell's palsy. Now, there the stress is not the direct reason why you get Bell's palsy, but what happens is when you are stressed, your immune system tremendously gets compromised. Okay, and when your immune system gets compromised, you fall sick. And Bell's palsy is a type of sickness where there's an inflammation in your ear. So that's one of the commonest reason why you get Bell's palsy. The second reason for getting Bell's palsy could be an viral infection, which happens due to reactivation of a dormant virus, which is called as herpes simplex virus. Now, at that point of time, this condition is called as Ramsay-Hunt syndrome. Ramsay-Hunt syndrome uh, okay, so hi, good day, miss. What is the main symptom that differ the Bell's palsy from stroke? I'll come to that. I'll come to that to your questions, guys. Let me first finish what I have to say. This is important because, so yeah, so that is called as Ramsay-Hunt syndrome, and Ramsay-Hunt syndrome could also give you partial paralysis or as one-sided paralysis of the face. The third reason you can get Bell's palsy is if you have got some sort of tumor present in your head, or else you have got some sort of injury to your head, or else to your nerve, or else to your ears. Hi, Sarika. Thank you for joining. So that is the reason why you could get Bell's palsy. And the last but not the least, if you have got undergone some sort of surgery, okay, due to for tumor removal or whatever it is, or else you have got some accident where there was some damage to your head and your ear, at that time also you develop Bell's palsy. Okay, so these are the reasons why you could develop Bell's palsy. Now, Bell's palsy itself is a separate problem, and most of the time, 90% of the time, people recover 100% from Bell's palsy. I would say more than 90% of the time. But what happens is why people see synkinesis and delay in recovery is because they tend to make some of the common mistakes in the early phase of Bell's palsy. If you avoid those mistakes at that point of time, you will have very less chance of developing synkinesis or developing residual symptoms. And that's where the don'ts and the do's comes into the picture. So one of the most biggest don'ts that I believe I would like to tell my patients is that please don't worry. When you worry a lot, okay, you are adding up to your stress phenomena, which has been the cause for your Bell's palsy itself. That's why worrying is not a solution. Instead, what you need to do at this point of time is to rest a lot. The more you rest, the higher the chances of recovery is there. Okay, that is first thing. The second thing, don't watch yourself repeatedly in front of mirror trying to develop movements, or else forcefully, or else forcing yourself to do movements on the face. Okay, that will lead to synkinesis. That's the biggest reason synkinesis develop. The third don't that I believe I like to tell to patient is don't take electrical stimulation in excess. Ideally, the randomized control trial studies as well as the textbook on facial nerve has clearly mentioned that 3 months time frame is the time frame where the nerve automatically with the help of medicines regenerate. We should wait till that time for the natural nerve recovery process to happen. After that, after 3 months is over, and if still you see contractions on, if you don't see any contraction on the face, then and then only you need electrical stimulation. But that rarely happens. You will definitely get contractions on the face within the 3 months of time frame. Yes, there are some situations when you might not get contraction. Situation number one, if you don't take your medicines on time, if you skip your medicines, if you think that the medicines is not required and I should not take medicines, let the healing happen naturally. No, first 72 hours are very crucial. At that point of time, if you take your medicines, then the pressure from the nerve releases and you gradually start recovering. If you don't take that medicine, if the pressure on the nerve stays for more than 72 hours, then there are chances that there could be some permanent damage that could happen on the nerve, which could lead to delayed recovery or else incomplete or else partial recovery. That's very important. Next thing that you should avoid doing in the early phase of Bell's palsy is trying to just watch a lot of TV, watch a lot of phone. Because what happens when you do that, you are stressing your eyes because eyes are at higher risk of damage at this point of time. And that's why it's very important that you should take care of your eyes. So, patch your eyes, tape your eyes. Whenever you're stepping out, cover your eyes well with the big glasses so that you don't land up with eye infection very easily. That is the next note. And when it comes to food, definitely There are some food you should avoid, even though it doesn't have the direct link with your Bell's palsy recovery, but it definitely impacts. Sugar, milk products, milk products in the sense milk and curd and buttermilk, that too taken in a very cold temperatures, those should be avoided. Okay, maida or else gluten and oil based products or else fried items. These are the things that you should avoid if you are suffering from Bell's palsy. So these are the don'ts which I wanted to discuss in today's video, and now I would take up your questions. So feel free to put them. So, hi Adil, I hope you are still there in the live session. So my left eye still shivering after 2 years from it. Why? So shivering in the left eyes that happens due to Bell's palsy is very common. This happens due to two things. One, your eyelids, right? They are tight and they are weaker. Okay, that's why it happens. And whenever you do other facial movements, when you develop synkinesis, you develop shivering around the eyes. So, in order to reduce the shivering around the eyes, you should stretch your eyelids this way every hour. Okay, that is first thing. Second thing, you should try not to forcefully close the eyes, because the more and more you try to forcefully close the eyes, the more and more shivering will happen. So these two things are the ways with which you can avoid shivering in your eyes. Shireen is asking, please share a video on leg spasticity exercise. Yes, Shireen, I'll come over it for sure. Fanny, what is the main symptom that differ the Bell's palsy from stroke? At fifth at the early stage, as we will feel numb. So the biggest difference in Bell's palsy and facial paralysis is facial paralysis. The paralysis happens to complete one side of the face from top till here. Okay, but in stroke-related facial paralysis, there is paralysis in the 1/4 of the face. So from nose till here, that is only paralyzed. Plus, along with the stroke, you have other symptoms involved, like your BP is raised, you have headaches, and you have slurring of speech. Your other areas of body also gets affected. So with those things, you get to know that whether it is stroke or else Bell's palsy. I hope that helps. Feel numb at the face. Feeling numb is not a very direct sign of Bell's palsy, yeah, but it is very common in stroke. Razak is asking, why am I still shivering after 2 years from by? Same thing, if your eyelids are weak, if you have synkinesis, then you have shivering. All you need to do is you need to stretch your eyelids more often. Adele is asking, since 2 years I had Bell's palsy and totally treated, but still my eyebrow and shivering from time to time. Is there any chance to fix that? So, eyebrow shivering, as I said again, it's the same question. Yes, this happens due to tightness around your eyelid and weakness of your eyelid. So, you should stretch your eyelid very often and then you need to close and open the eyes. But you should not do this, that's wrong exercise. Athin Aryan is asking, synkinesis is cured naturally or automatically? Synkinesis mostly is not cured naturally or automatically, but yes, if you pay less attention to it, it will reduce. If you pay very much attention to this, then it might increase. Dishan is asking, do you know Kannada? I'm really sorry. I understand Kannada to an extent, but I'm not fluent at it. So that's why I don't usually speak in Kannada. Hindi, English are the two languages which I'm very fluent with. Okay, guys. So I think I've answered all the question. If any other questions you guys have, you can put. We can. I'll wait for 5 more minutes. How to reduce pimples? Hi, Dishan. I'm really sorry. I am not a dermatologist. I'm not someone who can help you out with pimples related issue. If you have any questions related to Bell's palsy, then I would be able to help you in this video. Athen, your question answer again. Synkinesis is usually not cured automatically. You need to put some work towards it, okay? Because it's an habit-based thing. Synkinesis is not a disease, it's not a problem, that's why it's not cured, it's an habit. So, unlike any habit that can be broken, synkinesis can be broken, but you have a very high chance of getting it again if you don't work over it. I hope that helps. Okay, guys, so I think these are the only questions that have come for today's session. Anything else you would like to ask? Okay, so the next live video session is happening on this Wednesday, 5 p.m. So feel free to join that live session as well. For any question, that day I would be covering most of the questions related to cerebral palsy. Johnny is asking, can kinesio taping improve Bell's palsy? See, kinesio taping is used for facilitation of the movement. That helps, but kinesio taping is only done by an expert physiotherapist who knows kinesio taping. So you should not do it on yourself. You should definitely take a help from physiotherapists. They will just facilitate a movement. So like it will support a movement. That's it. Yeah, then I will wait. You can ask your question. Thank you, Sarika. Okay, so he Athin is asking a consulted doctor after a week. Okay. Hi Sagar. Hi Jo. Thank you. Most welcome, Georgie. I don't know. It was Bell's palsy. Okay. Um, See, Bell's palsy mostly happens suddenly. Okay, so it's not that you will not realize it. It cannot go unnoticed. Okay, so if it was not like 72 hours, uh, you should first see a neurologist. He would be able to better tell you because you need to get a proper history understood, and then only you will get a clear answer. I hope that helps. My heart is repeatedly beating. Then you have synkinesis, God's love. I hope that's your name. If eye is repeatedly beating, then it's a sign of synkinesis, and synkinesis needs to be worked by three things. One is muscle relaxation, second is massage, and then third is stretching, and fourth is neuromuscular re-education. Okay, guys, one more quick announcement I would like to do. I have launched my website. My website is now live. The name of the website is healthqrehab.com. You can book appointment with me by visiting to that website. I'll put the link here. So you can book directly the appointment consultation with me if you need personal help from me. Can I completely recover? I'm cured 95% since 1 year. Athin, we need to find out the cause behind it, how it happened. There are a lot of details that go into it. I would recommend if you can take up one consultation with me so that I can assess you and tell you how much is the possibility of recovery in your case. What to do and does in Bell's palsy. I have already mentioned in this video, God's love, about all the things that you should do and don't. So please, once this live session is over, please watch this video again. I have mentioned most important things that you should consider. I remember I had Bell's palsy in March, but when I pout, my mouth still slightly goes to one side. When I close my mouth, it is not noticeable. Saida, then you should still wait for the recovery to happen. Okay, you need to work on stretching your facial muscle, massage on a regular basis. That will help. Stem cell therapy. For what? So you are looking for stem cell therapy? Can I get recover within 3 days from Bell's palsy? No, that's not possible. It takes 3 months for the recovery to happen from Bell's palsy. My mother is experiencing eye twitch on her left eye after Bell's palsy. What to do about it? Apply hot fermentation to the eyes with the help of a cotton. Do some massage around the eyes. These are the ways with which you can prevent the eye twitching. Okay, Saida, I'll repeat. When your pout slightly goes on one side, that means you are developing some tightness around the face. So you should do regular stretching of your facial muscles. You should massage your face and apply hot fermentation on the face. Muscle in my upper lip twitch when my from my left face. What can I do for that, ma'am? The right face is Bell's palsy. I'm recovering from the 21 exercises you gave out. Okay, so if you are suffering from some twitches, that is a sign of synkinesis. That too, mostly the tightness also develops on the non-affected side, so you should also stretch your non-affected side as well. I have a video uploaded on how to massage your face and how to stretch your face for your reference, guys. Please watch that video and just try to do those massage. I'm doing physiotherapy at home by viewing your videos. The men's person getting watering water is pouring from one corner. If watering in the eyes happens, you should put more eye drops in your eyes. That is a sign of eye dryness. So that's one thing that you should do. I would recommend, guys, if you are in the acute or the early phase of Bell's palsy, please don't follow 21 exercise video. Instead, follow my video on exercises to do in the early or as acute phase of Bell's palsy. It's there on my YouTube channel. Please follow those exercises. 2-year-old Bell's palsy, how much time it take to recover approximately? 2 years old Bell's palsy mostly recovers completely. What you are left with is residuals. Residuals is not Bell's palsy but side effect of Bell's palsy, which needs to be assessed and figured out how to work on it. That would be my answer for you, Sudarshan. Okay, guys. So I have pretty much covered the questions that I wanted to ask, say about and answer. Nothing serious thing will happen while getting Bell's palsy. No, so Bell's palsy is not a life-threatening disorder. Nothing serious will happen. Yes, you are left with some weird face. But slowly, if you work on this, it can be improved to a lot of extent. Okay, guys. So I'll end this live session here. See you again on Wednesday, 5 p.m. So make sure to stay tuned and join me on this session. Thank you.